Okay, we're going to go ahead and get started. And again, thanks everybody for attending today's webinar on round 19 of the COVID-19 pandemic. And my name is Jeff Donnell, and I'm president of Enterprise Health, and I want to welcome you to today's webinar, where we're going to talk about some of the latest challenges that employers are facing as we continue to navigate the COVID-19 pandemic. And this is actually the 11th in a series of webinars that we started last year in response to COVID-19. And I know today we have, I think, more than 125 people who've signed up for today's session, so we really do appreciate all of you making time to attend. Just a couple of housekeeping items. We've muted everybody except for our panelists today so that we minimize background noise. We are recording the session, and afterwards, in the next couple of days, we'll send out an email to everyone with a link so that you can access the recording and certainly that you can share it with others. Also, we are going to have entertain questions at the end after all of our panelists talk. So there's both a chat and a Q&A feature in the WebEx. So just feel free to use the Q&A feature, post your questions, and we'll get to as many as we can toward the end of the session today. Today we have a great group. Our Enterprise Health Advisory Board is going to serve as our panel today, and we're very fortunate that we have an outside group of occupational health professionals that provide our organization with insights and guidance and advice. And like you, all of our panelists have been kind of neck deep in the turbulent waters of the COVID crisis. And each of our panelists brings a little different point of view with vantage points that include corporate, health system, legal, and consulting settings. So what we've done is we've asked each panelist to make a few initial remarks about their observations on today's topic. And as I said, we'll have a Q&A session. So again, feel free to submit your questions. So today with us, we have Dr. Fikry, Dr. Bhargav Chandrashekar, Dr. Al Rielly, and Dr. Kenji Saito. So gentlemen, we appreciate all of you joining us today. Before we turn it over to the panelists, I'm just going to give a little bit of context on our organization and today's topic. And I'm going to start really quickly with the Enterprise Health elevator pitch. And it goes like this. We're the only cloud-based health IT solution that combines occupational health and compliance, clinical care, and employee engagement on a single, interoperable, and certified electronic health record platform. And our focus is on equipping our clients and their employees for a healthier future. And we work with a group of blue chip global corporations, government agencies, hospitals and health systems that operate their own on-site employee health clinics, and in many cases also provide employee health services to other organizations. And this is just a smattering of some of the organizations that we work with today. And we've titled today's webinar Round 19 because, believe it or not, we are now in the 19th month since the World Health Organization officially declared the novel coronavirus that was soon to be labeled COVID-19 a public health emergency of international concern. So not quite to the point where it had been named a pandemic, but it was certainly a significant blip on the radar screen. And while 19 months ago, much of the general public may have continued to be blissfully unaware that a global pandemic loomed, I'm certain that many of you were already coming up to speed. You were busy planning your response. And here we are 19 months later, and we're still battling this disease. And certainly those folks who are involved in occupational and employee health have been on the front lines and have been very, very active in managing response for all of their organizations. And I know we're all familiar with, the ongoing set of very stable or very sobering statistics. And in the United States, as of late last week, there have been more than 33 million reported cases of COVID-19 and more than 600,000 deaths. And by comparison, there were just over 400,000 U.S. military casualties in World War II and nearly 117,000 in World War I. So just in terms of the casualties from those two world wars combined, they don't equal what we've seen in the United States in terms of deaths from COVID. And of course, globally, more than 184 million confirmed COVID-19 cases and nearly 4 million deaths. In terms of vaccinations in the U.S., we are at the point where nearly 70% of adults have had at least one COVID-19 vaccination, and worldwide, more than 3 billion vaccine doses have been administered. And of course, we're seeing wide variability by country, and in the United States, by state and locality. Of course, in many countries, access to vaccines is still a major challenge. And while in the U.S. that is far less of an issue, we all know that attitudes toward the vaccine tend to be one of the biggest barriers to getting shots in arms. I know for me, I live in a rural Indiana county, and we're only at the 55% mark. 55% of adults have had at least one dose, so that's well below the national average. And we know that there are states and localities that are doing far worse than that. And of course, the battle continues. And while COVID vaccines, decreased case rates, and other factors have enabled many of us to return to some sense of normalcy, the fight does continue well into round 19. And I think we see every indication that more rounds are going to follow. And since the early stages of this, what has become a battle royale, occupational and employee health professionals like all of you have been expected to keep coming out of the corner round after round, leading their employer organizations in a protracted fight with an unending series of twists and turns. And I know we had all kind of hoped that by now we wouldn't be continuing to talk about this topic or spend as much time as we are on it. The fact is it remains a top priority for anyone involved in occupational health. And you've all had to deal with symptom monitoring, testing, case management, remote work, hybrid work, contact tracing, telemedicine, vaccination, and the list goes on and on and on. And while the light at the end of the tunnel is not only visible, but shining a little bit brighter every day, we still find ourselves wrestling with a new laundry list, kind of punch after punch after punch. And some of the things we're still dealing with include now new COVID-19 variants, including probably the best known right now is the Delta variant, because it's not only more contagious, but according to some research published last week in Nature, it's able to sidestep antibodies that target certain parts of the virus, and it makes it that much more difficult to deal with. Of course, there's the issue of whether or not to require vaccinations to return to work. Some employers, especially in the health system sector, have decided to go this route. In fact, we have a client that's generated its fair share of media coverage and scrutiny for their stance on requiring vaccinations. And speaking of vaccinations, many organizations are contending with whether or not to require proof of vaccination. And I know many of our clients are using employee portals to enable employees to answer vaccine status questionnaires, upload proof of vaccination, or complete declination forms. And then once you've collected this information, there's also the question of what do you do with it? What can you do with it? And that varies certainly by country. And of course, the vaccination topic goes on beyond that, as employers also debate what to do when some people in their population have been vaccinated, some haven't, and of course, some people have no intention of ever getting jabbed. So as employees return to work, you have to think about how do these various cohorts get integrated into the workplace, and how do mask and social distancing policies and the like get properly applied. And then I think we all know that COVID vaccination has become highly politicized. There are conspiracy theories out there, all kinds of reasons that people have for not getting a vaccination. And it's, again, a challenge for employers to address this in order to help drive vaccination rates up. And then when you think about the topic of coming back to work, many organizations are still figuring out how much on-site, remote, and hybrid work to allow, and then how do you fairly and appropriately apply those policies. And as so many employers move to remote or hybrid work, then there's the issue of the economic impact in the communities where they operate. So tax revenues, impact on local businesses like restaurants and retailers, those are all impacted by the decisions that organizations make, not only that affect their employees, but again, that broader economic environment. And of course, the list of issues goes on and on and on, from mental health challenges to ever-changing guidance to new requirements from OSHA and other regulatory bodies. So clearly, as we've all seen, there's a long haul effect on the individuals who get a serious case of COVID-19. And likewise, there is a long tail effect on employer organizations and the occupational health professionals like you that are leading COVID recovery efforts. So what we've asked our panel to do today is to share some of their observations on these and other issues as they work with a variety of employers who are wrestling with the same things that most of you are. So starting us off today is Dr. Kenji Saito, and Kenji is the President and Chief Medical and Science Officer at MEDLAW, LLC. He's also the President of the Northeast Chapter of ACOM and is on the ACOM board. And he provides occupational and environmental medicine consultative services to companies, professional organizations, hospitals, and clinics. He's also a medical leader for regulatory agencies, consumer goods, and transportation industries. And Kenji is both an occupational health physician, but he is also an attorney, so he has a very unique perspective. So Kenji, we'll ask you to go ahead and start things off for us.
Great, thank you so much, Jeff, and good afternoon, everyone. It's a pleasure to be here today, and I appreciate everybody's attendance, and hopefully we'll have a good discussion today. Our goal is to hopefully allow us to have a discussion about what's going on and how do we move forward during this pandemic. So I'm going to go ahead and share my screen here and just talk about what is round 19 of COVID-19. I think it's a good time to discuss where we were, where we are now, and where we're hoping to be hopefully towards the end of this pandemic. So let's chat about what we've done so far. And I think before I get started, I want to make sure I do have some conflicts to notate. And Jeff has mentioned all my various roles I have, some academic appointments as well. Just a disclaimer that everything I talk about today is my opinions, not necessarily those of the people I work with or people I represent as clients. I do have some pictures I'm going to be using today, invoking copyright issues of fair use. But I want to jump right into the polling questions because that would give us an idea of where we are as to what we're hoping to talk about, maybe gear it towards some of the Q&A towards the end as well. So the question right now is, are you currently collecting any proof of vaccination at your workplace? Let's see if I can make this a little bit bigger, make myself smaller. And hopefully everybody can start chiming in through their online polling. I put the chat at the link in the chat box, and I also put it into the QR code if that's easier for you. So hopefully everybody starts able to get in. Wonderful. So it looks like some people are starting to respond. Thank you for that. So it looks like the majority of us are starting to collect some proof of vaccination. Well, there we go. As we get more people logged in, we'll get more comfortable with this. So we do have a couple of slides to warm everybody up with some multiple choice questions, and then I'm going to do some word clouding as well. So we'll split right now. So let's see, I'm going to go to the next question. So are you requiring vaccinations to return to work? And we'll talk about this too, and especially from my background, from a regulatory perspective, it'd be interesting to discuss what the EEOC has decided about these kind of questions. And I'm just going to go back to the previous slide. So it did shift a little bit. So it seems like most of us are not collecting proof of vaccination. And sorry, going back here again. And we're not requiring people to be vaccinated to return to work. So this makes it an interesting concept, especially from a public health perspective. And perhaps we can talk about this more during the Q&A and discussion session, because it really interferes with our idea of the true public health initiatives and the idea of vaccination rates. Jeff mentioned, the 70% sort of goal that we've had as a nation in the US. And we'll talk about this globally as well, because this really shifts the idea of individual liberties, public health, and how do you balance that in regards to individual rights, civil liberties, and what the public needs to be able to advance past this pandemic. So next question involves, is your employer going to continue to allow remote and/or hybrid kind of work? Or are you mostly requiring people to come back to in-person only? Are you going to allow all remote? Are you going to allow other options? And I'm curious to see what a majority of us have decided. And some people haven't decided or has gone back and forth. If you read the news, a lot of financial sector initially came out and said, you know what, we're going to require everybody to come back to the office. There were some articles that came out suggesting what Jeff was talking about, some of the economic impacts that we've had, especially when your employer owns the real estate and the headquarters of where your offices are, and they need that vacancy rate to drop. What do we do? So it seems like we don't have any of the extremes here with all in-person, all remote. Seems like a majority of people are balancing the hybrid. And we probably need to define what that means as well. And some of them are still undecided. So now, as we're approaching different variants, are you approaching it any differently? This is more of a open-ended kind of question, so we can post as much as you'd like to see what we can overall here. Sorry, the question here is overall, what is the one word you use to describe how you and your employer is handling the pandemic? And we'll go to the variant question next, but this is sort of prior to variants. How are we doing this? I think people are talking about fluidity. Good. It's being flexible, being resilient. And we'll talk about some of the mindfulness and some of the well-being, mental health and behavioral well-being. So it's really good that people are talking about how fluid you need to be, how cautious. On the other hand, you need to be as aggressive. As we can see, this kind of ties in with the idea of vaccinations, whether it's going to be mandatory or not, and what kind of goals. I'm almost scared to ask sort of what kind of goals and where people are at nationwide. But as Jeff mentioned, Indiana is at 55%. Some of the nations are almost at 70%. Some of the states that we've had some good successes there, and others not so much. So I think a majority of us think about flexibility, and that's why the word is kind of growing here, is that we need to have that sort of idea in occupational health. We really transformed and morphed this past 19 months from a, what do you do, occupational therapy, to all of a sudden, wow, employee health, occupational health, you understand, at the end of the day, the workforce, the human capital truly does have a huge impact, not only on the local businesses, but also to global businesses, as well as various economic institutions. As we can see, if you don't have health of the workforce, you definitely don't have health of the nation. So I think we've learned a lot. We're hoping to take some of this silver lining that we've gotten from the exposures we've received in occupational health, and hopefully we'll take it to the next level in what we can do, and to be able to be flexible, to be fluid, and to be able to understand how do we interface with economics, politics, society overall as we promote health and well-being. So this is great. We'll come back to this again because I think it's really important to focus on what we all thought about, what we've done, and the improvements we've seen in surveillance program as well. So this is very helpful. So now, will you be approaching the variants any differently than you have done in the past 19 months? And the question, that Jeff mentioned too was the Delta variant. Hopefully we've learned something this past 19 months. And the question then is, if we're going to have variants be introduced, because this might not be the first and the last of the pandemics that we'd see, hopefully the last in this century at least, but we need to learn because there's always going to be other natural disasters. And I think a huge part of what safety, security, and HR are starting to learn in occupational health and what we can offer is that we can be we can respond. We can help in crisis moments, and especially when it involves human capital and human beings and the public and our consumers or patients. So I think it's really important to learn that we have a process in place now and understand what is the benefits of occupational health. So it seems like most of us are not going to be approaching any differently, which is helpful. And those who are, it'll be nice to have this a discussion as well. So the question I have last here, and I'll leave some time for us to answer this, is what Jeff brought up at the end too. How are you as employers or representative of your employers addressing various economic impacts on communities in which you operate, such as any kind of impact on tax revenues, right? For example, if you're working in one state but live in another, which state is taxing you? We've always had this question before in sort of neighboring states, but now with remote work and hybrid opportunities, who should collect the income tax? Should it be the state, the locality where you work, where you live, combination of both? There's been compact agreements between various states in the past that allow for these things that might need to shift. So there's going to be a whole change in what that means and where you work, how you work, and who's going to get taxed for that. And I think that's eventually going to have to get settled at some point, whether through legislation or maybe through the courts. It'll be quite an interesting questions. The other question that came up is, how would you address this economic impact of local businesses? Some businesses were developed around the community of the employers. If you look at some of the large employers who house about 1,000 employees in one headquarters, and you have all these restaurants and other saloons and other businesses that popped up because of that, how's that going to impact you as an employer? So this is an open-ended question. I'll leave this open for a little bit. So as you want to chime in, we'll come back to this towards the end as well as to what do you think these economic impacts are? Should it matter? Should we factor that in as we kind of give our opinions as to a return to work model? And a lot of questions might be, I don't know. Maybe I'm not really sure how this is going to impact. And trust me, your CEOs will be thinking about this because especially if you're working at public health entities, there's always a question about, what is the perception of what your community is offering and how are you supporting your local community where you work? So it'll be interesting where people are thinking here, we adapt to the next normal. I think it should be the state of the business and established in. That could be it. And I think a lot of people are going to ask these interesting questions, right? Because some cities who rely on employees to come back to work in their physical locations may go out of business or bankrupt in a short amount of period when there's no income tax to be collected in that state. So it's going to be a challenge and an interesting question for the company, especially if you're headquartered in that city or locale where they do collect local and municipal income tax. So interesting question. Maybe we can talk about more during the discussion as well. So continue chiming in. It's an open-ended answer polling there. So while we're doing that and thinking about it, I sort of want to introduce the idea of public health law. This article just came out from a colleague at Tufts in New England, talking about sort of why do we need to protect civil liberties, especially during a pandemic. And this became a really hot topic, especially the idea of mandatory vaccinations, questions about health questions like, have you been vaccinated? How are we going to address this any differently from the other contagions like the influenza? Or people have asked, well, if schools can require MMR or not, and have waivers, whatnot, are we going to look at the SARS-CoV-2 any differently? As we develop different variants, are we going to respond to that differently? So it really comes to interesting questions about individual rights versus those of the public. And we've had a whole slew of public health law topics pop up saying, hey, when does the individual rights supersede those of the public? Or vice versa, when can the public welfare supersede your individual rights? And this became a very interesting question, especially here in the US. So I want to give us a bit of a global perspective before we go back and think about the US alone. And that is this article. Dr. Levine actually works over at Tufts in their Civil Liberties Department, and they talked about globally. So he looked at Hungary and Poland in the EU and say, okay, what have we looked at in regards to transparency of laws? And not only that, but we need to have some sort of predictable enforcement. As you've seen recently, when OSHA promulgated some of their rulings around COVID-19, it was a little later than what the CDC had announced a couple weeks prior. So that became a little issue, right? How, because, as we all know, OSHA is an enforcement branch, whereas the CDC and NIOSH is more of the sort of guidance branch. So that there's no teeth to what they say unless you can enforce it. So what we found in this study that Dr. Levine mentioned was, if you're going to have some public health law be implemented, we need some really good predictable enforcement opportunities, because otherwise it doesn't help curtail some of the civil society organization and sort of their perception of being free from repression. And what does the government do in giving a rationale behind that? So this really shows that Poland and Hungary went through the same issues. And this is a sort of historical perspective as to what was going on and how it's sort of inflective of what the past couple of years was in Poland and Hungary. So bringing it back to the US, it came up at a prime time. People wanted to understand, what are your individual rights versus the public health or the constitutional protections, especially for the sort of interference between the federal and state governments. But what are the ethical implications of it? What are the political aspects of COVID-19 measures, and how are they going to be enforced? So I think from the employment perspective, we know OSHA is going to be the enforcer. We know NIOSH and CDC can give guidance. And the question is, how does it interface with public health? As us who are board certified in occupational medicine, we're technically under the specialty of preventive medicine, and we specialize in occupational medicine. And for those who are residency trained, we're residency trained in occupational and environmental medicine. And so we have this short sharing of responsibility with public health, preventive medicine. The question is, how do we balance that? How do we harmonize those needs? So the question, it was a relevant one. And there's a whole hour course on this that luckily the CDC has promulgated, and looking at public health law and looking at what the opportunities are for understanding how does our health decisions impact laws. So here's a opportunity here. I'm going to go ahead and put into our chat box a link to the CDC educational series about public health professionals and how do we address that. So I want to share that with you, and we can go through that. But like I said, it's going to be an hour-long talk if I talk about public health law. It's quite interesting how to balance out our Constitution. If you think about our founding fathers, they really thought things through. They really gave us the three branches of government, the legislative, judicial, and executive, to really have that checks and balances. And public health sort of falls under the executive branch, right? Because the CDC is one of the executive agencies that directly reports to the president. And as we all know, NIOSH is part of the CDC, and OSHA is under another agency in the Department of Labor. So it's quite interesting that these laws kind of intermingle through administrative laws, but also through other public health initiatives. So it'd be interesting if you'd like to go ahead and go browse through the course that the CDC offers, and we can discuss this more at the end, towards the end as well. But going back to our previous questions, I'd be curious to see where we are with what people are thinking here. So I think people, let's see if there's any other comments. No, but we can talk about this more towards the end. So again, a warm welcome from New England. This is a picture from the White Mountains here in Maine / New Hampshire. So for those of us who ever get a chance to visit, I encourage you to come and check out New England. And if you have any other questions, I'll be happy to answer them towards the end. So I'm going to hand this back to Jeff.
Okay, thanks a lot, Kenji, and appreciate your perspective, and you know, especially both a medical and a legal one. Okay, next up is Dr. Fikry Isaac, and Dr. Isaac offers strategic advisory, market research, and board-level support to both public and private sector clients who are focused on global health and wellness strategies, policies, and solutions. Fik is a pioneer in the field of workplace health promotion and global health. He's the former vice president of global health services for Johnson & Johnson, and I know that he has been advising a number of different clients in different industries about how to navigate their way through COVID. So Fik, we'll hand it over to you to share a little bit about what you and your clients are wrestling with these days.
Thank you, Jeff, and a pleasure to be part of this discussion and to join this elite panelist. And thank you, Kenji, for doing the polling, and really helps kind of to guide the dialogue for all who are attending. As Jeff said, since I left Johnson & Johnson, I've been doing consulting, and what I would reflect on some kind of quick remarks on what I have seen as it relates to question asked at this stage. Most of the client that I have been supporting are either in the large, mid-sized to large corporation, and the more in the IT business or the financial business, and certainly in the pharma or the pharmaceutical business. So that's kind of really where the view will be coming from to share with you. So I think some of the question asked that are in what should you require the vaccination to come back to work? And as you saw from your own reflection, most of the companies that I have been supporting through the COVID pandemic do not require vaccination to come back to work. Certainly that has been quite a bit of a discussion. Should it be required? If we require vaccination, would that help us not to really apply a lot of the other measures such as the office rearrangement, the distancing, also to bring people quicker back to the office environment versus remote work, and I'll reflect on that later on. But overall, definitely, as Kenji stated, requiring vaccination does come with a huge number of issues, whether it is EOC related, whether it is ADA related, or others. And certainly you have to really, it's a complex process. It can certainly apply in certain categories, in certain jobs or sectors. But overall, the one I've been supporting, the recommendation has been, and again, that reflects my opinion as well as based on what I have seen in the marketplace, that requiring vaccination might not be the best way to bring people back to work. The next to that, should you collect the proof of vaccination and how it has been used? And what I have observed on those companies, one, all of them actually look at it from the angle, what exactly the purpose? Why would I be collecting the proof of vaccination? And if you can answer that question, because the driver for collecting the data or the vaccination record has to have a reason why. And what I have seen, most of them are now requiring or not requiring, asking on a volunteer basis to provide a proof of vaccination, and asking the employees to go to their HR portal and input their vaccination data or record. Certainly, I've seen in the manufacturing sector that has been, there is quite a bit of a push. However, it is not a requirement to have the vaccine record. On this note, most of them really were seeking, one, to apply the incentive. Many of the companies have implemented incentives to encourage people to receive the vaccine. And that basically would be a proof of vaccination would be required in order to receive the the discount, or to apply the incentive ruling. Others certainly are, as I mentioned, just requesting voluntarily to input the data into their system, and that's kind of really what I have seen. Some are basically asking for it just to kind of to get a percentage of vaccinated versus unvaccinated, and to kind of guide the return to the office type of planning. And that's kind of really which takes me to the next question, which has been, how do you manage return to work with a mix of vaccinated and unvaccinated individual? And that some of the folks have been supporting really requested quite a complex algorithms on how do we deal with the vaccinated versus unvaccinated. Do we require a home testing and a negative test on all versus only on the unvaccinated individuals? Should we have a designated space for vaccinated versus non-vaccinated to really ensure that the unvaccinated folks kind of really do not potentially have any issues with regard to being in the office setting? And as you could tell, this is very controversial. And right now, what I see out there is that the return to work started with doing home testing for all vaccinated and unvaccinated. Certainly, designated space really was extremely controversial, that most of the folks decided not to go with that route or in that route because of how complex, and also issues related to rules and regulation in bringing people back to work. With that said, at the moment, actually, I do not see, most of them did drop even the requirement for home testing and or on-site or niche site testing prior to return to work. And what they are doing is really staggering return to work with the mix of vaccinated and unvaccinated individual, while still applying, the questionnaire sets that people can respond to as it relate to symptoms versus, asymptomatic. And I think that's kind of again a direction as we see the percentage of vaccinated moving up the ladder, certainly with some exception in certain region or certain states. Now, the question also came about allowing the remote or the hybrid work, and as you saw on the response from this sample of all of you online, a lot actually moved into, especially in the financial business, moved into almost 100% a remote for those who are not, for certain categories where they do not have to engage face-to-face with customer, not customer facing. Most of those roles can be done remotely, and actually some companies felt that will save them money as it relates to real estate, especially in in the cities like New York and or in Los Angeles, for example. Some are actually did want, especially one financial investment company, really wanted all employees to be back in the workplace physically, despite the fact that they have been doing the remote work for almost a year and a half already. Part of the desire, and that may reflect on the next question, was actually they are investing quite a bit in real estate businesses, and therefore they really want to keep the real estate business live and avoid the issues of no occupancy. So it varies by the business type, but most of them really wanted everybody back to the office in some format, and the hybrid model appears to be the way most are heading towards, with the exception, of course, in certain setting, manufacturing and other types of arrangement where you need people on the ground, healthcare, and I'm sure Al will reflect on that as we get through. With that said, the hybrid model, some did apply, the week on, week off, working from home. Some actually relaxed their hours and allowed people now, since they have home-based type of setup, allow them to take their work and go home and do that. Others also, like Fridays, they are now being more flexible as it relates to fully being in the office, and will be still continue to be a learning curve for corporation and their management on how to handle this, as there's still some resistance to the invisible or absent, physical absence in the workplace, and we'll see how that evolve over the next few months. Regarding the implication, as I mentioned, one example where that was the driver. Another example where a business really is the source of the nourishment within their locale or within their city and within their town. And one of their CEO push was really to bring people back to the office, because certainly that allows people to go out, utilize the restaurants, have meetings, hotel occupancy improvement, and all of these things. So bottom line, really, it depends on one, the culture within the business. It depends on the driver of the business, as wherever they are, on how can they support the communities around them and or if they do have a business reason to bring people into the workplace. I'm going to stop here. I can certainly keep going, but I will stop here and return it back to Jeff.
Thank you, Fik. Appreciate it. Okay, next up is Bhargav Chandrashekar. Dr. Chandrashekar is an occupational health physician at GLAXOSMITHKLINE, and he's involved in OC Health program management across multiple R&D and manufacturing clinics for GSK in North America. Also contributes to employee health and wellness strategy and delivery, working with safety professionals, HR professionals, and other business leaders. And he also provides consultation and leadership on population health, employee health, and well-being issues. So Bhargav, we will turn it over to you.
Thanks a lot, Jeff. And just checking, you can make sure you can hear me nice and clear.
Yes.
Okay, great. Thank you so much for the opportunity to be a part of this webinar and to be part of the panel. And thank you, Kenji and Fik, for your comments, and really helpful to see where the audience is coming in this conversation. Absolutely, I think that the title is correct. 19 months in, I can't wait for the day we can stop using the term social distancing. And for me, really just a couple high principles that I noted. Really, like I mentioned to you, Jeff, before, this has been the Super Bowl, I think, for occupational health, and one of the just most incredible ways we've been put in the spotlight as a function and as a specialty. And compared to, I think, the old time of employees interacting with our function as, oh, I went downstairs to get a respirator fit test or a TB test or something. They came and adjusted my chair or something just really different than what we're doing today. I really want to take the time to recognize how much we've all grown in this past year and a half, and how much we've had to learn, and how much we've had to lean in and support the business in probably ways that we never expected, either through training or just in decades being in this field. And what I found really sort of neat was the comfort I sensed in the decision-making process when the poll question came up. Are you going to significantly change things when the variants were coming out? And most people said no. But I still saw keywords coming out, that flexibility and fluidity. So there is this, what I took from that, it was this appreciation for evolving data, but a sense of comfort and confidence in decision-making that we've all learned through the first reports of a virus in Wuhan and how it's moved across the world. So really, I would encourage people in the audience, as well as my colleagues in this panel, to continue growing that skill set and gaining that confidence, and always using a data-driven approach. And I think that's certainly served me well as I've supported GlaxoSmithKline through COVID. And the common theme, I think, through all the topics that we will probably get into, if not, or if we haven't already, is the notion of trust. And absolutely, as medical professionals and a lot of administrators, I'm sure on the call, it's the goal is to not do any harm. And the trust is whether employees are wondering, what are you going to do with my vaccine data? Or for at-risk workers or unvaccinated workers, can I trust you to create that safe workplace? And of course, it's you need to have a robust occupational health team, and of course the IT infrastructure to keep all this data. And the more you can confidently say the infrastructure is in place, that's going to go a long way in the decisions you make in this evolving landscape. Occupational health professionals have routinely been at the intersection, I think, between HR professionals, employment law, certainly safety professionals, and sort of that conduit to the business and business leaders, and helping them navigate. We are very comfortable with an accommodation process, or sort of the squishy side of where medicine lands with different occupations. So really tapping into that strength and that experience that we've built in other situations besides COVID, and using that. And just the last point really from me is the way I'm looking at this for GSK, or for anybody else I would advise that is navigating the situation, is when you're dealing with, oh, what might OSHA think about this, or the ETS just came out and I need to change everything. Really, I think any regulator is looking for a good faith effort. And for you to take a really a data-driven and sensible approach to whatever you're doing. For example, a lot of the OSHA requirements include continuing to provide PPE. They know you can't completely change the workplace overnight, but it's what are you continuing to do? Do you have a plan in place? Are you looking at the data, whether it's vaccination rate, whether it's community case rates? Do you know that there are variants happening? And things like, are you giving time off for your employees to go get vaccinated? The term communal areas has come out for continuing to protect populations. Unless you're an employer that's going to require vaccination for the foreseeable future, you're always going to have a mixed population. And this has been there before COVID. You've always had people that couldn't get certain vaccinations because had allergies to certain components in a vaccine, or vaccinations were ineffective if they had certain immunocompromising conditions, or what is even more pervasive is people that have loved ones at home who either are immunocompromised or are ineligible for vaccines. So you're always going to have this spectrum, and that's why I would stress always looking at the workplace and putting sensible things in to protect everybody to the extent possible. And for example, I just mentioned about communal areas. We struggled with how to implement guidance there, and I was thinking about the parts of a workplace that people cannot teleconference to or have to use by virtue of just being on site. We think about restrooms or where they may congregate to get food in the cafeteria, and really keeping some of those social distancing markers and some of the obvious signage there. And whereas in an open plan seating, where you do have the flexibility, you can walk away, you can distance yourself there to take down some of the signage. And this is an approach to take into consideration the increased subsequently, I apologize, the increasing vaccination rate, the low case rate, but at the same time you are being cognizant of where you might have a mixed population interacting with each other more frequently, or they have to use a certain service on site. So really the point I'm trying to drive here is to take a sensible approach, be thoughtful about it, take your time. There's certainly no rush to change things, and give yourself that flexibility to keep up with the changes. Thanks, Jeff.
Thank you, Bhargav. Okay, and our final panelist today is Dr. Al Rielly, and Dr. Al is the Medical Director of Occupational Health at Massachusetts General Hospital, and he has been in the occupational health field for quite some time with some of the largest medical facilities in the industry, and he serves as a physician in the Department of Medicine at Cambridge Health Alliance, and is also a clinical instructor at Harvard Medical School. So Al, definitely interested in hearing your perspective from somebody who's working in the hospital and health system space.
Thank you very much. Good afternoon. And again, just to reiterate, like the other speakers, these are my opinions and not necessarily the opinions of my employers or the individuals and companies that I consult with. In some ways, healthcare, specifically hospitals, already collected information about vaccination. Just as background, prior to COVID, there was guidance for healthcare workers to be vaccinated against common transmissible diseases like measles, mumps, rubella. There were some states who had legislation, for example, New York required that if you worked in a hospital, you had to show proof of vaccination immunity against measles and rubella. In Massachusetts, if you worked in maternal child health, you had to show vaccinations against rubella. Obviously, EEO and ADA, if someone had a medical contraindication or a sincerely held religious belief or preference, if possible, if that could be reasonably accommodated, that was in place. Also, the federal government a number of years ago required hospitals to report the percentage of hospital workers who had been vaccinated against influenza or declined influenza vaccination. So that information already was being captured by hospitals, collected and stored confidentially in the confidential medical record. Some states allowed hospitals to make influenza vaccination required for hospital workers. And what some hospitals did, if the person had a medical or religious reason why that they couldn't get vaccinated, they were required to wear a mask. So with COVID, some of these issues are still in place, and you may have seen in the news that some large hospital systems, such as Mass General Brigham, Yale, Henry Ford, University of California, New York Presbyterian, Mercy Health, University of Pennsylvania, Houston Methodist are requiring vaccination. Obviously, if someone has a religious or medical contraindication, they might be eligible for a reasonable accommodation. What's going to make this difficult is there are some states that are considering or already passed legislation barring COVID vaccine mandates. So it's going to be very difficult for corporations, hospital systems with a large footprint in multiple states to keep track because there may be local differences. Currently, recommendations for personal protective equipment for healthcare workers remain unchanged. So again, the current guidance is healthcare workers should continue to wear source control, meaning masking, when they're in the healthcare facility, including break rooms or in other spaces where they may encounter coworkers. In March, the CDC had updated their guidance to clarify that if an asymptomatic healthcare worker who was fully vaccinated had a high-risk exposure, they didn't need to be restricted from work. So hospitals were already capturing that information because as part of infection control and source testing, if someone had an exposure, you would reach out to the employee and find out if they were fully vaccinated, they wouldn't need to be restricted from work. You may have also seen in the news for hospitals, OSHA came out with a new emergency temporary standard that required new requirements to protect healthcare workers and healthcare support workers. With some exceptions, the emergency temporary standard applies to all settings where any employee who provides healthcare services or healthcare support services. So the standard, again, OSHA enforcement, requires organizations to have a hazard assessment, a written plan, and a classification of risk. And the idea is that a hospital, would require policies and procedures to minimize the risk of transmission to COVID for each employees. Part of that standard requires that patient screening where direct patient care is provided. So employers must limit the number of entrances to the facility, screen patients, residents, and non-employees for symptoms of COVID, and follow CDC guidance about infection prevention and control. Also, with the temporary standard, employees have to screen employees before each workday, and the employer must require employees to promptly notify the employer of a confirmed positive test for COVID, a diagnosis or reported suspicion of COVID infection, or symptoms consistent with COVID. The standard also requires healthcare employers to provide and ensure the use of personal protective equipment and social distancing. If social distancing isn't feasible to maintain a distance of 6 feet from other people, the employer must ensure that the employee is far apart as feasible, and that may require overlapping controls such as physical barriers, source control, hygiene, and ventilation. So in some ways for hospitals, the workers are still going to wear a mask and still do a lot of the controls that were recommended earlier in the pandemic. As was mentioned earlier, federal EEO laws do not prevent the employer from requiring all employees physically entering a workplace to be vaccinated for COVID, subject to reasonable accommodation. Again, as part of that interactive process, the analysis for undue hardship depends on whether the accommodation is for a medical contraindication or for religious belief or preference. Some of the standard reasonable accommodation might be employers who can't get vaccinated, that they have to wear a mask. Well, they're already doing that in hospitals. Work at social distancing from coworkers, which again is probably already occurring in hospitals where it can occur. Again, or maybe modify their shift if possible. They may require periodic tests for COVID. That remains to be seen for hospitals that don't require vaccination. Be given the opportunity of teleworking if possible, or finally to accept a reassignment if possible. So again, many hospitals are requiring vaccination. What the OSHA emergency temporary standard also requires employers to support COVID vaccination for their employees by giving reasonable time off during work hours and paid leave for the full vaccination series and any side effects experienced following vaccination. Generally, OSHA presumes that if an employer makes available up to 4 hours of paid leave for each dose of the vaccine, as well as 16 additional hours of leave for any side effects of the doses from vaccine. OSHA recognizes that a hospital, if they're providing on-site vaccination, they don't need to give as much as 4 hours. But again, the OSHA standard is encouraging employers to encourage vaccination for their employees. As I mentioned, some large care hospital systems are requiring or vaccination for COVID. And again, there are some states that are barring vaccine mandates for COVID. So it'll be interesting to see how this plays out in the upcoming months. And thank you very much for your time.
All right, great. Thank you, Al. Appreciate it. All right, we now have about 30 minutes left over for questions. So again, if you have questions, feel free to submit those in the Q&A section. And one of my colleagues, Kevin Nelson, is going to help me kind of moderate and kind of keep track of some of those questions. One thing I wanted to ask, Bhargav, it was interesting. You talked about trust and the importance of employers building trust with their employee populations. And of course, that's a challenge. I mean, you're doing so in an environment where there tends to be a fair amount of distrust and lots of reasons for that, whether it's people's concerns about lack of trust in governmental authorities, distrust because of all the changing guidance and not being able to keep up with what's the latest and greatest. I think some of that is probably tied to fatigue as well. But I'd love to hear from the panelists on, kind of how do employer organizations build trust, and also how do you do things like, encourage employee populations who are reluctant to get the vaccine to maybe go ahead and do so. What are some of the strategies that you're doing, because that's certainly tied to trust?
Hi, this is Al. I can maybe give some examples of some organizations that I've been working with that are not hospitals or healthcare. What they were doing, again, in facilities for non-healthcare workers, they were requiring masking, but if an employee was able to document that they were fully vaccinated, they would show proof of vaccination to employee health that would record that information, and then that employee wouldn't have to wear a mask anymore. They would wear like a lanyard or a badge, so everyone would know it was voluntary. If someone was vaccinated and chose not to do that, they would continue to wear the mask. Also, the employer was providing time for individuals to be vaccinated, and it seemed like that was a good way that if people knew that if they documented that they were fully vaccinated and they no longer had to wear a mask, many employees were interested in voluntarily taking the employer up on that option.
So this is Kenji. So as a professor of bioethics and a former bioethics researcher, this question always comes up a lot about what can we do to help people trust? And I think trust and transparency goes hand in hand. So whether it's transparency of what we do in occupational health, for example, the conflict of interest that we have. And we talk a lot about this in our sort of specialty profession, is that we are one of the few sort of physicians out there that wear multiple hats, whether it's in the business world as one of the company employees or a corporate employee versus being in academics, where we look at both the sort of the financial, political, and societal impacts of public health initiative, weighing it against individuals' rights. So I think it's really important to understand sort of transparency as one component, but also understanding that it's also what do people perceive as what trust is, and how do we accommodate and balance and harmonize the differences between what we do as a physician, what we do as a company employee or government official or academic professorship or understanding of research, and how do we balance and harmonize those three things, and being transparent to not only employees, our patients, or the population as to the risks and benefits, but truly get the idea of informed consent around what we're asking to do when they get vaccinated, sharing the best available data, evidence-based medicine that we're trying to promote here, and be able to gain that trust so we can sustain the level of access. And a good example is if you look at Japan, when people think, wow, one of the more industrialized countries in the world, advanced technology, but the lowest vaccination rates. And it comes down to the idea of trust that they've had and looking at sort of the medical history behind vaccinations in Japan. And goes back to World War II, what's happened in some of the testing situations. So looking at the idea of cultural competencies around what informed consent means, how do we develop that level of trust as a healthcare provider, as a business person, as a company? It really comes down to being transparent and very informative in risking and weighing the risks and benefits of any action we take. And a lot of it is looking at the consumer rights as we look in the US standards around what the availability of information is. Make sure we advocate that people do get the best information available to them. So I think those are the things that we need to talk about to develop that kind of trust. Thanks.
This is Fik here. I'll add regarding the trust factor. You know, I would go back to the fact that you cannot expect trust to be built overnight. It's really part of the culture within an organization that has been developed over a period of time. But some of the things that employees are searching and looking for is, does the company care about my health and well-being or not? And I think that's kind of really comes in the way how they have been managing their health and their well-being over time. Certainly, you know, with the pandemic issues, you could see a lot of companies beefed up their mental well-being program, their services to help employees cope as well as deal with a lot of the stressors related to the pandemic, from financial to health to caring for others and so on. So that's one piece of the trust factor. I want to say as well that the issue of trust, you know, comes from the fact that the company is treating me in the best possible way to show, you know, my best of ability, my abilities, and that really help overall to deal with the you know, with the facts related to the issue of vaccination versus not. A lot of companies have done a huge you know, communication strategies and ongoing communication with their employees. Keep in mind, communication help building more of the dialogue around what's going on, especially for the remote individual, and how to guide them through that. Certainly, I mentioned the incentive, although the incentive factor in helping people getting the vaccine certainly is an extrinsic type of incentive versus, you know, people really, you know, kind of standing in line to get the vaccine. But a lot of those things, and the other piece to it is the ability of those employers to ensure that there is the proper setup and the proper, like really removing all the obstacles for people to receive the vaccine or get it on time. I think Kenji indicated, you know, giving, you know, time off. Some have been giving, like, you know, the day of the vaccine, and then others have actually been more generous and giving the next day because of the expected, some of the potential reaction to the vaccine. But the strategy has been really to try to beef up communication as they have done in the past, encouraging and promoting, for example, the influenza vaccine.
If I could just, this is Bhargav, just to add to that, really, when you think about it from an individual to a population health perspective, I can share a couple of things that have worked well here at GSK. I would just say, when somebody shares a concern, even at an individual level, first, I try to assume positive intent. I think a lot of the times there's so much emotion in whatever topic we're discussing, that coming in with positive intent and assuming that perhaps they just need a little bit more information, or give them a different perspective of what other types of employees they may be around. When you're talking, I'm referring to somebody who's adamant against vaccination or doesn't want to share their vaccination records, or sort of give them that perspective of what the site population really looks like. And then you can sort of work your way up, right, all the way up to a town hall setting. But I think it's starting at the individual level. What's worked well is having other senior executives or other folks in the company talk about the importance of vaccination, showing that how they've been vaccinated, and how it's been how it continues to be the safest way to protect themselves as well as their loved ones. Really engaging with employee resource groups. So these could be around race, gender, because sometimes it's difficult to know what exactly is the barrier, not just to getting vaccinated, but also to disclosing vaccination status. So tapping into groups that employees are already part of, and engaging those leaders in those groups to have a panel or have an opportunity to discuss this, and to create that space where employees can ask questions either in an anonymous fashion or sort of to speak up, and then giving them a different platform to reassure them. And finally, like I mentioned, the town hall settings have been really, really helpful for us to get perspective from large groups of people, and to answer questions also at scale. So starting at the individual level and work your way up depending on what your organization is, whether it's a healthcare, a hospital setting, or a corporate setting, and you have a lot of opportunities around you in terms of groups or allies that are there to support either vaccination efforts or some of the other stuff the panelists have mentioned. Thanks, Jeff.
Great, thank you. Kevin, do we have some questions from the audience?
Yeah, we do have a few, so we'll try to get through some of them here. So the first one, and this is a story that actually I was reading something about just this morning that's in the news and very topical, is about the Pfizer vaccine and them announcing a potential third shot or booster. And somebody's asking about thoughts on that and thoughts on, how companies are navigating those waters with flu season coming up. And that can be for anybody, so.
Yeah, so this is Bhargav. Maybe I'll kick it up. I think I did see that as well, and it's interesting that Pfizer is pushing for the vaccine based on their internal data, that immunity is dropping after 2 shots, and I think even Israel, which has the highest prevalence of the Delta variant, or at least one of the first countries that had the highest cases of Delta variant, are even offering a Pfizer booster mainly for their immunocompromised population. So it's certain adults that fall in certain categories, but it's not for the wide public. And what I found interesting was right after Pfizer did that, the CDC and the FDA both came out saying, we don't believe that a booster is needed, but we certainly are monitoring the data, et cetera. But I think it is something that we will, as a group, need to continue to watch. And it'll be, again, it comes back to transparency and for Pfizer to show what data they're using, and to compare that with the regulators to make a logical decision of whether maybe it's Pfizer's vaccine, maybe it's another vaccine that might come out from a competitor that would be better suited for the variants that are coming out.
Yeah, and this is Kenji. I want to add too, this is a good example of how evidence needs to be presented in a way that needs to be not only transparent but also politically correct in a lot of ways, that Pfizer kind of made this announcement without going to the FDA and CDC prior. So if you read the news, people go back and forth saying, well, why didn't they do that beforehand? And should they have? And I think the process has been changed a bit since the pandemic. So it's a whole new world of information sharing now too, that we need to be very cognizant of. And as occupational health providers or leaders in this area for employee health, I think we need to look at the data ourselves as well, and make sure it fits the patient population or the employee population you're looking to serve, and which variants are being affected, and where the immunity levels are for your workforce. So it's quite interesting how we're trying to balance it all out right now and really find a good medium between booster or not, or vaccination or not, and depending where you are in the world, what the risk factors are for getting that booster.
Okay, Kevin, what other questions do we have?
Thank you. Yeah. We've got a question from somebody regarding the Delta variant and how that may or may not impact return to work strategies such as vaccination status, masking, testing, those kinds of things.
This is Vic Isaac here. Just a quick comment on that. From what I have seen, yes, that question comes up. Most the employers that I have been involved with or support, they're really not, really planning anything other than what might be coming as a recommendation from health authorities, CDC, and others related to the issue of the Delta variant. And they're it's like basically doing a watch and see, still following their basic approaches that they have followed with the COVID-19 initial kind of phase, or steps, but no one is really planning, at least the one I've been involved with, to do anything different at the moment on their planning to return people to work. Certainly keeping that, have some concern of what might happen, and certainly most of them don't want to take a step back from progress made so far to bring everybody into the work, whether already or by the fall.
Okay.
Thank you, Fik.
Yeah, we've got a couple of questions around the emergency use authorization status. And Kenji, this might be a good one for you to start with. And they kind of revolve around this idea, like, does that emergency use authorization have any legal implications that companies need to be concerned about or are affecting their decision making right now versus full-blown approval?
Yeah, so from a regulatory perspective, there is a difference between emergency use versus a full-blown, and we need to wait to see because there hasn't been a lot of case laws around this because we never had such a pandemic of this size in our history. So modern history, I should say. But the question right now is, are they immune? We're not really sure. The question is even arising in workers' comp too, as we've seen with some of the earlier uses of, for example, medical marijuana. The workers' comp system kind of works it through very differently from the rest of the public. So I guess my answer is, unfortunately, a lawyer's answer. It depends on a really case-by-case basis and see what that means, because it does differentiate from the FDA regulations and what the CDC recommends. And the question then becomes is, what is this going to look like a year from now, 2 years from now, or potentially in the future? We really don't know yet, but that's a great question and something you need to stay tuned to as to whether there's going to be a legislative or administrative answer, meaning a regulatory rulemaking process will indicate whether there's immunity for pharmaceuticals who introduce these new novel technologies during an emergency crisis, or what's going to happen afterwards. And I think that's going to have to be really up to the regulatory agencies to decide otherwise through legislation through Congress. So great question. Stay tuned.
Well, as a follow-up to that, Kenji, we have another question that's asking, do you think employers' stance on mandating vaccines will potentially change once it transitions from EAU to full approval?
Yeah, so just like the last question too, I think it really depends. But unfortunately, if you're going to mandate something and then reverse track later, that's a bit of a challenge. And I think a lot of employers are very hesitant in doing that. So make sure you get it right initially. And if you're going to go one way or another, reversing track, it's going to be challenging. So I think make sure you have all the data in place as to what you're hoping to do. And I think as most of us panelists talked about today, except for healthcare, OSHA doesn't really have a lot of guidance on this since it's geared towards specifically healthcare. If you're going to go above and beyond what's required, be very careful and make sure you communicate appropriately as to the rationale as to why you're going to mandate versus in those cases where maybe your essential worker is needed in a face-to-face, like manufacturing or in healthcare, where that can't be remote. So I think it really depends on your risks and benefits. And this is where risk management is having a sort of a fiesta right now about what to do, because it's all about risk management and communication at this point, since we don't have clear guidance and regulatory protections or mandates on what to do. So I think it's really a free-for-all, and this is why a lot of employers and businesses are really taking the safer route, conservative route, saying let's do what's required at the minimum, and then if anything above and beyond, make it voluntary.
All right, thank you for that. We have one more question here regarding somebody who looks like they're struggling a little bit with monitoring what's going on with different states. Our different states have, she's specifically asked for presumptive infection laws and workers' comp claims. And maybe the question is there a resource for tracking this between the different states and the differences if you have employees residing in different states?
So there are trackers out there. I'll see if I can find one and put it into the chat box.
Okay.
Okay. Yeah, I was going to say, Kenji, if you're able to find some content on that, we can share that as part of our follow-up as well. That would be great.
Mm-hmm.
Here's a question, and I know we probably just have about 10 minutes left, so we need to start to draw things to a close. But Bhargav, you commented earlier that that really the COVID-19 pandemic has kind of been the Super Bowl for occupational health, and we know that the Super Bowl is not quite yet over. But at some point, you know, this thing will draw to some sort of a close, and then we'll start a new season. I'm really interested from the perspective of each of our panelists of, you know, once we kind of get through COVID-19 and we go back to either some semblance of normal or whatever the new normal is, how do you think the practice of occupational medicine is going to change? And you know, kind of what maybe different role do you see that occupational and employee health is going to play in employer organizations going forward? You know, given what we've been through in so far the last 19 months, you know, I can't I have to imagine that this is going to have a profound impact on the way that occupational and employee health is viewed going forward. But I'd love to hear maybe some of your crystal ball thoughts on, you know, what do you think things are going to look like as we cycle through this and start to get back to some sense of normalcy.
Yeah, maybe I can kick that off, and yeah, it feels like triple overtime, Jeff, to the Super Bowl, and yeah, it's been a hell of a ride. But really, I think the future of occupational health is it's going to be a lot where I think it's going is a bigger part in the employee experience, and what I mean by that is that we've all played a role in supporting employees through this pandemic, whether they're at work, whether they're at home, whether they're somewhere in between, and it's been at such different parts of their life, taking such a deep dive into their personal medical history, their greatest, some of their deepest, darkest fears of coming to work, and like we've talked so much about hybrid working. How do we help employers still stay connected to their employees at home, and how do we help them keep engaged? And can I have social events, and can I do this, and can I do that? So I think we're hopefully, I see occupational health and certainly a medical director or in the healthcare side or the corporate side is having a seat at the table of what the future employee will be and what their experience will be at your organization, and then starting at mental health and everything we've learned about it through this pandemic. If it wasn't we talked about a little bit about it before COVID, and now we're going to be talking for quite a while after this. And then I've heard the term that this feels like another world war, in the sense that people are going to really be feeling the after effects of this for a long time. And so really playing an important role in well-being, physical, mental, emotional well-being, and staying close to that, really, between the employer and the employee. I hope occupational health stays there and gets a seat at the table, and doesn't just revert to some of the stuff we used to do before COVID, and then we take the learnings from this experience and keep growing.
Great, thank you.
Hi, this is Al. I agree. Just to second that, I think, right now with COVID, it really enhanced the visibility for occupational health. And hopefully going forward, it's going to be an opportunity to continue to influence organizations to support the well-being of employees. I would say from a healthcare perspective, masking may be something that will be going forward, might be an issue. We're getting into influenza season soon, and no one knows what it's going to be like, because last year the cases were down because of COVID and masking and the shutdown. So I wonder going forward if masking, at least for part of the year, might be the new normal for healthcare.
Oh, interesting.
Yeah, this is Fikry here. Just to add one additional comment related to the question, Jeff. From what I see, yeah, definitely with the COVID pandemic, the level of the professional need for expertise in the area of occupational medicine, health, and well-being kind of really raised to the top, and certainly has been much appreciated and much elevated. The question was how long this might last, and in my view, actually, I think it's going to be very cyclic, and it's not going to, be kind of ongoing. Certainly, large corporations that have been well established, they either have their on-site service delivery, they have their medical director, and or they have near sites and or other types of support. I do believe that will continue and that will never go away, because that's kind of really part of the trust factor in the medical community that has been built over time between the employer, the employee, and the provider. But other than that, I think, as the business cycles move into, again, expanding and then shrinking, the same is going to happen again. And I do believe, people tend to forget. I hate to say that, but that's going to be a cyclic approach. I don't know if it will, the value is going to be sustained, and it may be, again, another crisis that will raise the bar on the need of the occupational health and the medical professional. But that's just my opinion.
Thank you, Fik. Kenji, anything to add?
Yeah, I mean, I love these future questions because as a futurist, I always like to think about these things. And I want to comment a couple of things about the idea of masking. If you look at different cultures around the world, like in Southeast Asia, it's always common courtesy to wear a mask when you're ill or you're feeling you might be contagious or sneezing or coughing or any other possible contagions. It's just to wear that. And my hope, which I don't think it's realistic at this point, is that we'll see that in the US as well. Or just the idea of just proper hygiene. The idea of just washing your hands, and the idea of just spreading diseases through sneezing or coughing and having that sort of common courtesy amongst our neighbors or friends or coworkers. Hopefully that will stick. It's just one of those hopes that we have in sort of the idea of public health and prevention. But from occupational health perspective, I think the other silver lining that we're missing here is the revolution of digital health. I mean, within a year, 19 months, we've taken sort of what we've done in the past decade around evolving our telemedicine, telehealth initiatives, our digital health expansions, and the idea of integrating some of the knowledge we have through big data analysis and using predictive analytics. And people are starting to look at AI and machine learning in very different ways. I'm hoping we'll keep that momentum going and take this as an opportunity to really enhance what we've learned this past 19 months. As I mentioned in my survey question, will we do anything differently? Hopefully we'll have a process now so that we can look at different crises and different emergencies that arises in our field and learn from it and be able to have this process in place so we can apply it and really learn from it and grow from it and have a really good international collaborative around what we can do as occupational providers, being a forefront of employee health and really promote good, strong prevention methods and evidence-based medicines towards treatment and quick reaction to these kind of emergencies that occurs throughout the world every year. So on that note, I would hope that we're seeing a brighter future, and we're almost there. So hang in there.
Right. Well, again, I really want to thank all of our panelists. So Bhargav and Al and Kenji and Fik, really appreciate your time today. Not only preparing but answering questions. Appreciate everybody for attending today's webinar, and I wish we had another hour to go because we're getting a lot of great questions. But unfortunately, we're at the end of our time. Again, we did record this, so we will be sending out a link to the recording along with some follow-up information here over the next couple of days. And then we'll also go through the additional questions that were submitted and see if we can't pull together some responses as well to help satisfy some of your interest. But again, thanks to all of you. We appreciate you tuning in today and talking about round 19. And I'll echo what Kenji said. Hopefully we don't end up here next year talking about round 36 or whatever the number might be, but that the light at the end of the tunnel will get even brighter, and soon we will return to some sense of normal or the new normal. But again, thanks all of you.
Thanks everyone. Have a great one.
Take care.